At what point did you look around and say, I need to build a company to fix this?
So, what normally happens is the mouth becomes like an isolated part of the body, and dentistry becomes a separate subject while we have one human body. And I felt the need for holistic healthcare.
And how was it going from a certain profession to an uncertainty of entrepreneurship?
So I think we all are untrained entrepreneurs. Even somebody who's running a single chair setup, small setup also, 150 square feet, is an entrepreneur.
What has been your biggest mistake when you started HealthChakra?
As an entrepreneur, I feel when you hire people, a wrong hire is more expensive to you than not hiring at all and leaving the post vacant.
Welcome to my podcast, The Dental Lens. Today we are joining by an esteemed guest, Dr. Ruchiraa Khanna. Dr. Ruchiraa Khanna is a prosthodontist and the Chief Medical Officer of HealthChakra, a company she built on the belief that oral health is the gateway to overall well-being. With expertise spanning clinical dentistry, entrepreneurship, and leadership, Dr. Khanna collaborates with specialists across disciplines to deliver truly holistic care. She is also the driving force behind HealthChakra's Dental Van, a community outreach initiative bringing dental care to underserved populations. A passionate advocate for women in healthcare, Dr. Khanna inspires patients and professionals alike to see the body and health as a whole. Welcome, Dr. Ruchiraa. Thank you for giving your time.
Thank you, Dr. Syeda, for having me on your podcast. And it's a pleasure to join you today. Thank you.
So, you are a clinician by training, a prosthodontist. At what point did you look around and say, I need to build a company to fix this, rather than just practice dentistry?
So it was not a separate thought as such in my mind. But when the pandemic struck, I realized at that time that many people did not understand the importance of preventive healthcare and how it is connected to the rest of preventive healthcare in general, right? As far as general medicine is concerned. So, what normally happens is the mouth becomes like an isolated part of the body, and dentistry becomes a separate subject as compared to your other medical sciences, while we have one human body. And I felt the need for holistic healthcare, which is how the name Health Chakra, because it actually talks of aligning all the chakras of the human body as per yoga and Ayurveda, right? So I felt that we needed to spread this message to people that preventive oral health care and oral health care is important and is an integral part of your general health. And that's how Health Chakra came into being.
So, now, was there a specific moment like that made starting HealthChakra inevitable?
See, I was already practicing for 15 years before Health Chakra started, right? So I felt that there was a lot more to explore and a lot more to spread the message of good oral health. So, in that span of previous years of practice, what I observed was that people only come to us when there's pain.
Yes.
They only approach a dentist when there is a problem, right? So,
Yes.
I felt that we needed to spread the message that you come to us before there is a problem. We can prevent the problem from happening. And I felt opening a company and starting it with a bigger source of marketing and messaging, reaching across to people was very, very important. So, in that way, you can say that was the turning point because I feel in a clinic we are very limited.
Yes.
Don't get me wrong, I was very satisfied with my clinical practice. We had several clinics across the city. So I was extremely satisfied with my clinical practice. But then I think it's a little selfish if you're not spreading knowledge, if you're not training the younger generation also into gaining that insight from us. And which is why this structured organization came into place where we actually started putting down our experience into writing and training younger dentists so that they could also, work in a similar manner.
I think we need to pass on our knowledge to the younger dentists, to keep the community education alive. And it is it's kind of a responsibility of us also to give back to the community. I think it's a very noble cause that you are doing.
Thank you so much.
So, what did the people around you say when you told them that you were going to build a healthcare startup? Was there doubt, resistance, or support?
So there was doubt for sure. It was not easy. It took us a lot of conversation, a lot of brainstorming to actually come up with a model which people could understand and which will lead to maximum outreach. So, resistance in the sense that, people still, like I said, consider dentistry as a branch which is not mainstream healthcare.
Yes.
That is where the main resistance was from. But it takes a little time and effort to explain to every sector of society about what we are talking. So, it was easier because of the COVID pandemic because people started understanding the value of oral health.
Mm.
The disease
Yeah.
spreads from the oral cavity, which is the only portal of entry, or from the nose. So when you're wearing a mask, and so many people were suffering from mucormycosis,
Mm.
and they were told to rinse their mouth by their physicians with mouthwash or with betadine. So they started understanding, and they got very scared of any kind of infection. So that kind of made our conversations a little easier.
Okay. It kind of propelled the dentistry into mainstream COVID.
Yes, it did.
So, how was it, ma'am? Like going from a certain profession to an uncertainty of entrepreneurship.
Hmm.
So, how did you manage the move or the transition? I may say.
It's a good question, but I would like to give credit to all private practitioners over here because I think we all are untrained entrepreneurs.
Yes.
Even somebody who's running a single chair setup, small setup also, 150 square feet, is an entrepreneur.
Yes. They
Sadly,
have to.
we are not trained to do that.
Hmm.
And you
And
learn by trial and error. Yeah, sorry.
I know. I think that is the best thing. Like we are born entrepreneurs from the graduation itself. Like in the industry, when you start your clinic, you have to look at the every aspect of your practice, and it gives us.
Absolutely.
Yeah.
So I think
It.
we were already managing 7 clinics at one point. Before COVID, we had 9 centers in the city. So I think I was already used to the entrepreneur mindset. So that was not a major transition for me. In fact, forming a company made the organization and structuring, along with our experience, a more, let's just say, an effective approach. It was difficult because in startups, you put in your everything and
Yes.
I have a family to take care of and children. So financially, yes, it is a very difficult phase. And for
Mm.
any startup to take off, especially healthcare startup to take off, you need to build trust.
Yes.
So it takes a good 3 years at least, I'm saying. And we are still a very young startup. We are only 4.5 years old right now. So it is still difficult. But what I can say is that it's been a very rewarding experience.
Mm-hmm.
When I hire doctors, when I talk to organizations, what I say first is we are not, you know, business people running an organization. We are doctors running a healthcare setup. So there is a major difference. We don't think like businessmen, we think like doctors.
Yes. In entrepreneurship, risk is a major factor. Like when you open a clinic, at least we can say that in 3 to 5 years it will run on its own, even with the word of mouth. But as an entrepreneur, you cannot guarantee that success with your startup.
Mhm. It is a major responsibility because you have so many people dependent on you, work wise and personal life, both ways. You have to really give it your all. All I can say is there is no job which is too small
Yes.
or there is no job which is too big, and you have to step into every role in the
Yes.
beginning. Yes.
You have to
Yeah.
be everything. Whatever is needed, you have to become that.
You have to become everything from the dental assistant. It was very difficult for me after so many years of practice. When we are starting a new center, then I still have to see from ground everything from garbage disposal to biodegradable waste segregation to accounting to billing to patient management to hiring. You have to be at it all the time. There is nothing known as a break for us.
So, as a woman leading both a clinical practice and a company, how did you balance everything with family and entrepreneurship, clinical practice?
You know what? We paint women to be the superheroes who can manage it all. Let me tell
Yes.
you, it's not true.
It just
It
leads to burnout.
Yes. What happens is that see, I have two teenage daughters. Okay, and it was very difficult. Thankfully, my husband and I are running the company together, and he's also a periodontist. So It helps to share the burden. In fact, he's the one who came up with the idea of health chakra. And we both executed it together. So there was all the family support and spouse support for sure, but it is very, very difficult. And anybody stepping into, in any way, I feel even clinical dentistry is very stressful. Running your own practice and doing clinical dentistry. After so many years, also, I get sleepless nights if my patient is uncomfortable.
Yes.
So that transition is not done yet because I'm still seeing patients every day.
Okay. Ma'am, you said that working with younger professionals keeps you on your toes. What have they taught you that surprised you?
See, everybody likes to, bash Gen Z.
Mm.
That Gen Zs are lazy, that they don't want to work. I don't think so. I feel that with the right motivation, they work very, very well.
Yes.
Because they come from a place in which they were not deprived of things, their thought process is very different. So I really enjoy that thought process. That because I think the current generation works without fear.
They lead with purpose.
Yes, they live with purpose. So they want to be, they're not only looking for work, but they're looking for work which satisfies them. So that has given me an entirely new perspective on working, that I look for work which is making me happy. And I want to do work which is making me happy rather than just, the grind, everyday grind. So that is something which keeps me on my toes with them.
Ma'am, what has been your biggest mistake when you started the health chakra, and what did it teach you?
Mm. See, I've made many mistakes. Okay. And I'm still making many mistakes on a daily basis. So that mistake part is not, it's not over and done with. But as an entrepreneur, I feel when you hire people, hmm,
Mm.
uh, for me now, when I look to hire somebody, the mistake which I was making earlier was I was going by the degrees and the experience,
Mm.
which is what we all look at for the beginning, right? When we are hiring a new person.
Yes.
A wrong hire is more expensive to you than not hiring at all and leaving the post vacant.
True.
Okay. So, over a period of time, what I've realized is that I need to have a conversation with the person I'm hiring. Okay. I need to see what kind of human being they are. Because the kind of human being you are translates into what kind of a doctor you are.
It translates into work ethic,
It
and
translates into work ethic.
actually we need to align our personalities as well, like believe in the same mission, believe in the same vision. Then only if they are self motivated, then it will be an asset to the company. If not, then as you said, they are more expensive than being not hired.
Exactly. And I have made that mistake. And see, it's a very tough task. You can't really judge somebody in one interview. It's not really possible at times. You have to see them work. But for me to tell somebody that I don't like your work is a very difficult thing. I find it extremely difficult to give a critical analysis to people. So I'm getting there. I think that's a major mistake in my personality and in the way that I work, because that is the kind of person I am. But now I'm learning to give critical analysis. People should also learn to take it constructively.
Especially coming from a senior, if you're open to criticism only, then you will develop. Otherwise, if you bring in the ego, then even your development is stunned.
Yeah, see, this is the problem with our profession. How are we different from the corporate sector? Let's compare it with the IT sector. Over there, you are
Hello.
constantly given critical analysis, right? And you learn to accept it and to improve it. Over here, in the doctor fraternity, ego comes in.
Yes.
So that is what I tell my junior doctors. Maybe my mode of communication has always been a little gentle, and I have tried to tone it down. But what I started realizing is I started telling people the analysis. It's not criticism. It's analysis of your work. It is not a criticism of you as a human being. You need to separate the two things. You
Yes.
can't take it personally.
True.
So one has to learn to differentiate between professional and personal.
Even if you take the criticism only, then only you can grow. Otherwise, it will stun your growth.
It will definitely stunt your growth for sure.
Ma'am, like what is HealthChakra and what problem were you trying to solve when you founded it?
So, HealthChakra is a holistic dental healthcare company, okay,
Hmm.
in which we want to integrate dentistry into general medical healthcare.
Hmm.
We cannot have the mouth as an isolated part which is disconnected from the rest of the body. So, when you're in seventh or eighth standard and you read the digestive system, the first part in that diagram that they show you is the teeth,
Mouth.
the mouth, and the tongue, and then you go to the esophagus. So, when did this happen that dentistry became something which is outside the hospital in a clinic,
Yeah.
right? So, what we are trying to solve is see, as the population of the world is growing older, there are a
Hmm.
lot of comorbidities, even in the younger generation. I mean, age doesn't have any criteria for comorbidities right now. For example, let's take up, something like PCOD. Teenage girls are now suffering from PCOD and PCOS, and the oral manifestations of that are very different from what you would find normally, right?
Yes.
So, and their treatment is based on the fact that they should have no inflammatory factors in the body.
Hmm.
And
True.
they tend to suffer from more gingivitis because of the estrogen progesterone imbalance that they have. So we have had to talk to gynecologists, we've had to talk to physicians, and we want to bridge the gap. That is the problem that we are trying to solve. That the entire body is one unit, needs to be treated as a whole. Our treatment will not be successful till the general medicine part of it is taken care of, till the general physiology is taken care of, or whatever pathology is there. And their problems cannot also be solved till the dental issues are solved.
Yes. So how did other medical specialties react to it, ma'am? Like what was their response when you were trying to bridge the gap?
See, most of them have been, it's taken a little time to have these conversations. It's taken 2-3 years to reach that point where they will listen to us. It's not easy, but
Hmm.
once we've spoken to them and conveyed our message, they've been extremely cooperative. It takes a little time because that's not how we are taught in college, whether it's BDS or MBBS. You're not taught in that manner that you have to collaborate with other specializations.
Yes. Especially with dentistry.
Exactly. So now, after such a long time, see, when we were doing private practice, we were already collaborating with physicians and gynecologists and ENT specialists, and they were sending our patients to us, and we were sending our patients to them. So we already had that established. But on a larger scale, this conversation has taken some time. And I think people have heard us out only because we are already experienced in this field. So I can imagine how difficult it is for the younger generation to talk to somebody who's 20 years senior to them as a
Yes.
physician or a gynecologist. It's extremely difficult. They will not listen to you directly.
Yes.
So I hope that we are providing that platform where young dentists are getting this opportunity to communicate with senior doctors.
I think the major problem is that even medical professionals do not take the oral health seriously. They think
Yes,
it
it's
is.
a problem.
Yeah.
Till
That
they
is.
themselves have a dental problem, then they start understanding.
Otherwise, they think like you just deal with 32 teeth. But there are studies where uh, like plaque has led to the cardiovascular diseases also, and gingivitis being a major marker of diabetes and pre-diabetic thing. I think we can just prevent the major diseases if you concentrate on the mouth. And recently, I had a discussion with a scientist who was working on salivary diagnostics, like
Hmm.
with saliva. So that is also an underpenetrated thing. And if we promote it, maybe they will get to know that how important is saliva, like how many biomarkers are there in the saliva also.
Exactly. There should be a DNA analysis based only on saliva. You don't even need to take out blood. You will
Yes,
get to know so many predispositions to diseases only from saliva and
only.
your mycobacteria in your oral cavity. Yeah.
But because of the lack of knowledge within medical fraternity itself, it is not that common as blood tests or something else like that. So I think
It
even coming under one roof and discussing this medical and dental relationship will move the conversation forward a lot.
absolutely. So this is what we have always been aiming for And we are having conversations with the medical fraternity. We are in talks with them constantly. And I hope in my lifetime I get to see that change also.
Hopefully, yeah. Ma'am, do you plan like a big conference and all? Do you think there should be a conference where both the fraternities come together and discuss it? The conversation is starting, like we have some webinars or one day workshop like that, but it is not on the large scale.
Conferences might help. I don't know. But people normally go to conferences to get the conference points,
Yes.
right? Hmm? And I'm not saying it's not helpful. I recently attended a diabetes conclave and I was very highly impressed and I gained so much knowledge from that. But I think it needs to become a part of the curriculum somewhere down the line.
Yeah, yeah, the
Like
textbooks.
we have MBBS teachers, MD medicine, general surgery teachers. I
Hmm.
think maybe there has to be a dentist also teaching the MBBS students a little
Hmm.
bit about our specialization and how to collaborate. There has to be, when you have an internship, there has to be some collaboration with the dental department also for your medical students.
Yes. Actually, ma'am, this conversation is going on from 1900s. Recently, I had written an
Mhm.
article about a dentist who discovered X-ray, dental X-ray. The name is leaving my mind. But from 1930s, he's trying to collaborate between the health and medical specialities. He's saying that doctors should be taught the dental subject in their curriculum. So I think after all these years, almost 100 years, still there is no change. So I don't know what will happen next.
I'm hoping that this will change. I'm seeing the change happen. I am definitely seeing the change happen. Now, see, because this is thanks to dental implants.
Yes.
Okay. I think more of a change has come in after implants were introduced in the last 30 years because to place an implant, you need all the blood parameters to be reasonably fine.
Hmm.
So
And you
there
check
has been
calcium, vitamin D3, and also.
everything. So what happens is there is a collaboration between doctors and the general specializations, between an orthopedic surgeon, between a general physician, and
Mhm.
we also get a lot of people who are pregnant. So for their treatments, we get a lot of pediatric patients. So we have to collaborate with pediatricians, with pediatric endocrinologists, with pediatric anesthetists, neonatal also. So what I am seeing is I am seeing a very positive change,
Mhm.
and I am seeing that the collaboration is increasing. But yes, I will still say that it is very difficult for the younger dentists to get into this. I mean, it has taken me 20 years to start this conversation.
And ma'am, you're setting the stage for the younger dentists to come and take up.
I don't think that we are doing anything like that. If by I would love for it to happen, but I can't take the credit for this. I'm sure there are many other people also working in a similar manner. But whatever contribution we can make on our side, I'm more than happy to do it.
The scientist name, doctor name was Dr. C. Edmund Kells. Kells.
Okay.
He was the one
Yes.
who started the X-ray, and he's
Mhm.
saying 1930s that we have to teach the medical professionals about this, because during that time they used to remove all the good teeth. Since if there was any infection in the
Mhm.
body, they used to think that it is from the teeth, and they used to remove the good teeth as well. To challenge
Mhm.
that, he was saying that you have to teach the medical students about dentistry. It was in 1896.
Just imagine. Oh God,
Yeah,
more than 100 years ago.
more than
So
100 years.
I was having a conversation with an orthopedic surgeon recently, in which I was saying that you don't need to only check the long bones. The mandible is a very good indicator of bone density.
Yes.
And we can see that in an IOPA, you don't need to wait for a big X-ray or a bone density analysis. I mean, basic analysis can be done from an IOPA also of a person's jaw, lower jaw. And it was a revelation to them because they never imagined it.
And the sarcastic part is that an orthopedic gave us the dental implants, Dr. Brainmark. The
But
start
see,
of that.
exactly, I'm sure he understood this.
Yes. But there was not many leading his path.
Hmm. Exactly. But orthopedic surgeons, sorry, are quite open to this idea, and I collaborate very regularly with them. In fact, I think it's one of the closest branches that we have where we can collaborate well.
Yes.
Gynecologists also, for women, for sure.
Yeah. Ma'am, like, how does a journey begin? How does a patient's journey begin with health chakra?
Okay. So, how a patient's journey begins with us is we differ from a general clinical practice in the way that when a patient comes in, we are just not treating the problem that they have.
Hmm.
Okay, initially that's what we were doing. When they came into us, they came in with the problem. Now, at least our set of patients who we've been seeing for the past few years have been coming for preventive cleanings, have
Hmm.
been coming for getting their restorations polished, have been coming to, just check on the previous restorations. So our first consultation is, according to us, considered the most important consultation. So me and my team, we make sure that in the first consultation, either we are taking an intraoral scan or an OPG, and we are explaining in detail everything to the patient.
Patient
So,
education.
yes, we do a thorough education of the patient. And we are not trying to tell them what treatments need to be done. Okay. We will, if, of course, if they have a problem, if they've come in with pain or something, we will obviously concentrate on the chief complaint. But during the course of the treatment, we will make sure that the patient is aware of. I tell my team, like, behave like a fortune teller. Hmm?
Hmm.
Tell the patient what can go wrong in the next 6 months, in the next 1 year, and probably in the next 2 to 5 years, so that they are mentally prepared. Dentistry is, people are not scared of dentistry, they are scared of something that they don't know.
Yes.
So if you can educate them, and it depends on how open the patient is also, right? So
Hmm.
you have to actually counsel them a little bit so that they are open to understanding what you are saying.
True. Ma'am, I was searching about this thing on
Mhm.
ChatGPT, and your website came up for that there are only 4% of the dentists go 4% of the people who are going to dentist in India, and many of the facts that ChatGPT took from your website.
Oh,
That's
really?
yeah, that's how I came to know about HealthChakra. I was researching for my LinkedIn articles and I post regularly. So I was searching about this, and with your website, I came to know about HealthChakra, and then I searched for you, founders of HealthChakra. So that's how I got to your profile. So I
So,
think,
like I said, you have to
yeah,
do everything. So, a lot of that content is written by us only.
and that's why there are no other, like, only references are there, but there are no such publications that is doing, like, focusing more on this. So ChatGPT's first resource was your website. So I
I'm so
think
thankful to ChatGPT.
it has become a mark of things that are going in the world, no, ma'am. Like, everyone is going to ChatGPT for the questions, and
Exactly.
coming there is, like, I am sure you haven't done like any SEO or GEO like we are doing. So it was the authentic data that the ChatGPT took from your website and showed me.
So, how you asked me one major mistake now. I'll
Hmm.
tell you this. And I would like to tell all healthcare entrepreneurs this. The
Hmm.
biggest mistake I made was to put money in marketing in the beginning.
Hmm.
Hmm? I'm not saying marketing is not helpful, but in healthcare, okay, the most important thing is building trust and reaching the patient.
Yes.
Your online marketing, your SEO, it works up to a very certain extent. So if you are planning your budget, I mean, don't make the mistake of giving too much to marketing. Good work speaks for itself.
Yes. Like, marketing can get, like I said, it will get you the awareness when I was searching for it. But building that trust will take another thing to do it.
Exactly. You will not believe me, Sayeda. In the last 1.5 years, we have not spent a penny on marketing.
Ma'am, I'm a dental marketer.
I'm sorry.
I'm a dental marketer. I do
Sorry.
marketing. It's okay.
I'm so sorry to say that. See, but you are a dental marketer, right? You understand exactly what the conversation we are having, right? This is focused towards our work. What I mean is, you can't hire an agency which is doing marketing for a restaurant, okay?
Hmm, yes.
and who is showing you a very nice flashy portfolio of a cosmetic brand, and they
Yes.
want to market you. It does not work like that.
Actually, my
Dentists can market dentistry for sure.
yes. Actually, my story began like that only. I was working with a clinic and they were doing this digital marketing. And there were so many mistakes. They were directly taking the articles from the US websites and posting it, not even
Yes.
bothering to read it completely. And that dental clinic name was there in the article. So
Hmm.
I went to my boss or doctor, senior doctor, and I said, I can do better than this. I will write articles for you. I will design the marketing for you. I was just a curious person. So that's how we started our company, Take It Interest. Like we do marketing now. It's almost 9 years we are doing this. So I think that you said like a general person cannot understand the conversations because the psychology of the patients, like why they will come to a dentist.
Exactly. So what you are saying now, I got so fed up because I would have 30 posts which are supposed to be placed on social media, and I'm sitting throughout the night only making spelling changes. It's absolutely ridiculous. And it has to be targeted marketing. It has to be somebody who understands, who's worked with patients, and who understands the profession. You can't have like red, orange, and green color to show in your posts. I mean,
Yes.
it goes completely against our profession in that manner.
Like you should know
And
why you are sharing this post and
exactly.
what will it achieve.
And you can't have, you are not selling clothes or shoes. You
Yes.
are a doctor and you are a healthcare organization. There is a certain dignity, there's a certain gravity associated with it. So you have to spread knowledge, and that is how people will come to you. That's what I personally feel. Like
Yeah.
what value are you giving to their life? It has to be something thoughtful. It has to be a message which people resonate with. It can't be just, outright something, some marketing strategy which is working for a restaurant or a shoe shop or something. I had somebody who was working for a shoe shop and was telling me how they increase the scales of that shoe shop. So
That is like somebody trusting you with their health, with their body, some completely different than wearing a shoe. Right? Like you can return it or you can, exchange it, never buy
exactly.
that again. But for dentist, still, it's not like that. So actually, I started because of this frustration of my senior doctor that he was getting all these things and he made me in charge of see like what they are doing. And that marketing people were getting frustrated with me and they complained against me that she is making us redo everything. So
I know exactly the situation, and I have gone through this.
yeah.
Me
Actually,
and my junior doctors were fed up of trying to explain what we are saying.
what? Yeah, that is context is important for healthcare. And there are not many, like right now, some dentists are getting into digital marketing. But when I started, ours was the first company in India who started with focused on dental marketing. Digital marketing companies were many, but dental focus was very less.
It's a good thing that you're focusing, you know exactly what your target is, and you know what dentists will require and what patients are looking for. More than what dentists require, you know what patients are looking for. So to get the right message across to the right kind of population is very important.
Yes, true. Like I have come, like with marketing also, completed my studies. I'm also a prosthodontist.
Oh,
So
wonderful. I didn't know that. Yeah.
yeah. I finished in 2022.
Hmm.
So marketing
Okay.
is like my passion, like a curiosity driven thing that I'm doing now. I started with this podcast. Like I wanted to start the conversation about mainly about women entrepreneurs in dentistry and how women clinicians are balancing everything. But
Hmm.
it is leading to a bigger prospects. Like I have got a good response and it is growing bigger actually.
I'm happy to know that. I'm glad somebody is doing this because I think we need to be heard. It's very important. Women in dentistry need to be heard.
Yes. And then because our profession is like we need to have a good hand skills, and it will affect if you are not in practice. When you are pregnant, when you take a break and go back to the practice, you have to have that learning period of like at least 3 to 4 months. You have to get accustomed to it. There's career breaks, and when we went for go for jobs, they ask for 10 to 8. And being a woman, it is difficult. It was difficult for me. I don't know about others, but I thought like this is the discussion we need to have how women dentists can thrive in this profession.
Hmm. It is difficult for sure. man, like I said, we just paint women to be the super people who manage everything. It is not possible.
Yes.
One person cannot manage everything. You have to have a proper system, a network. And I hate to say that men are helping, because they're not helping. They are a part of the system. So everybody has to help each other.
They should also take the responsibility of the family and thing like the emotional baggage, the mental stress. It is much more bigger for women. Like double stress thing is there for women.
So I have been very blessed where this is concerned. I have a very supportive husband and a very supportive family. So I think a lot of credit goes to my husband and to my family also, because realistically speaking, we would all like to think that, women can do it all and they can do it on their own, but nobody, regardless of gender, nobody can do anything alone.
That is true. Ma'am. Like for men, the support is given, but for women, if we get support, we have to be grateful for it. And one of the like
True.
greatest conversation I had was like if we like many dentists are there, even my colleagues who have stopped practicing dentistry because
Hmm.
of the family situations and all, but they still get to listen like what was your use of studying, what use did your education came, you are still doing the cooking, you are still doing this. So I think even the society, even other women pull women down. If
Oh,
we
yes. Oh,
if we
yes,
focus on
definitely.
profession, we focus on profession, we are guilty of neglecting our family. If we focus on family, we are guilty of neglecting on our profession. And 80% of the women dentists are not practicing right now.
I am aware of this. Even after doing MDS, some of them are not practicing.
Yes.
So, you know, um, doctor, what I would like to tell the younger dentists over here is that I know it's very difficult, especially when you had a child, and
Yes.
you're also when your spouse is not in the medical profession and they're earning more than you. Because frankly speaking, the remuneration in dentistry in the beginning is not that great. So I would suggest that just be at it. The time you leave your work, even
Hmm.
if you're working part time, continue working.
Yes. I'm like we if we are earning less. Like one of my this is one of my friend's story. She had to fight for her career. Like, what is the use of earning so less, and you're moving away from your child? You are not giving time to your child. You are not giving time to home. What is the use of working so full as when I'm earning? I think, and she's just working part time just to keep her profession alive. Like, if we don't work, like we lose our hand skills. And also, that is the only reason that at least 3 to 4 hours I'm going to work. And she's passionate about dentistry. So, like seeing these things, I thought like there should be a conversation about women in dentistry, like how they are managing things, and bring that to light.
So, in my own small way, I have been trying to help people as far as this is concerned, because most organizations don't entertain anybody part time, but we try to accommodate as and when possible. You know, and see, remuneration wise, sadly, in our profession, it takes a good 8 to 10 years before you actually start getting paid for your skills. That is and maybe women should have this conversation before they get married.
But
One
people
should be
change.
very clear.
Yeah, how much good we have. Like later on, if they change, we cannot do it. It happens. It's very
That's
common.
also a fact.
Before marriage, they promise you the world, and after marriage, that world is in your home. So
Yes, I've seen this happen with many people, and it's very sad. But see, what you need to understand is dentistry is also a very competitive field. Hmm?
yes.
So, you, when you are in college, when you are doing your internship, when you have 1 or 2 years of work experience after that, first and foremost, uh, get all the work experience before you get married if possible,
Hmm.
so that you are in a position where you can fight for your profession, like you said, right?
Yes.
Because then you do, if you are good and if you are skilled, if you have built your skills while you are completing your BDS or while completing your MDS, if you worked in places, see, at that time you can afford to work for less. You can afford to do locum practices when you're doing your internship, or post MDS or something. Not post MDS, of course, but just before you plan to go in for MDS, a year or two you should be compromising.
Yes.
Immediately after doing your BDS, one should get into hardcore clinical practice, and not think too much in terms of money at that point in time. Look for experience, look for the right kind of work. Hmm? Once you've got that, and once you've got the required experience, then people will hire you and they will pay you well.
Yes. Skills first approach we have to keep.
Also, I see a lot of content on LinkedIn in which people are talking about start your clinic early, hmm?
Hmm.
Build your own client base and patient base. I beg to differ where this is concerned, especially for women dentists. It I am not discouraging anybody from opening their own practice, but please gain enough experience in a well established setup before you decide to take that plunge.
I think practice is just not about clinical skills, ma'am. Like if you're working somewhere and something goes wrong, you have a senior doctor to take care of it. But if you start as soon as you do, if anything goes wrong, then the is on you. And other than that, practice management is a different mentality, a different mindset is needed for the complete mindset. I mean, practice management. So because of that, also, if you work with 2 to 3 years or max 5 years, if you work somewhere, you will understand, you will grasp everything when you are just graduated and working under someone. I think I like how I started my marketing thing. I was like curious about everything, what sir was doing, how he's talking to the patient, how he's doing everything. So I think that is necessary before starting our own practice.
What is also important is you have to factor in what is going to be the cost of acquisition of the setup, right?
Yes.
Whether you're buying the entire place or you're taking it on rent, what is going to be the equipment cost? What level of practice do you want to start? Now, for example, I have been using an intraoral scanner for the past 5 years, where people
Mm.
were just beginning to understand the concept, but now it has become a practice requirement.
Yes.
It increases the cost of establishing your own setup, and then you should think in terms of ROI.
Yes.
So, all of these things, because if you're family, you need family support to start a practice,
Hmm.
right? Or
That
you're
is.
taking a loan. You should go into it with your eyes open.
Hmm. Like how much cash is needed to survive? Like first, as
Exactly.
soon as you open, the patients will not come. So at least you have to have 6 months to 1 year buffer. If you're renting, especially, the rent will be the major part of the expense for a practice. So all these things will come with experience.
Exactly. So one should not be like, immediately after passing out, I want to establish my own clinic. I have seen like many girls after getting married, they get forced into starting their own practice by the family. That why are you working for somebody else? You do your own thing, which leads to a lot of negative feedback later. Because, like you and I know, after establishing a practice, it takes quite some time to
Yes.
establish a regular income in the practice,
Yes.
right?
Like-
So,
Yes.
that is also my advice. Please do a job, learn everything properly, understand your shortcomings, and work on them before you take a leap of starting your own practice. And do a thorough analysis of the place. What is the point? I mean, I live in Pune. I see in one building there are five dentists.
Yes. I think and we have seen practices that are closed also, 1 year or two. Even one of my colleagues' practice, he opened as soon as we finished BDS, and within a year it was closed because we were not as experienced. And he was calling specialist for every consultations, so it was not sustainable for him. And they
Hmm.
had parents had invested, like it was back in 2015, like 10 years back, at 10 lakh practice, single chair,
Yeah.
but it was 10 lakhs. And 1 year later, he had to sell everything at loss, and now he's in US doing completely something else. So like take a practical decision, not an emotional one. I would
And have a
say.
mentor. So we have helped many of the dentists who are working with us who wanted to start their own setups. We have helped them establish their setups, where pricing is concerned, of chairs, of equipment, of materials, because you need to know somebody who understands how this is. Otherwise, it's very, very difficult. You will end
Yes,
up overspending. So my advice is to have a mentor who can guide you through this also.
yes, true. Mentorship is actually very important in the beginning of your career, especially. And in every part of life, I feel like you need a separate eyes to see at your work,
Yes,
because you will not know your own shortcomings, but someone coming from outside seeing your work or seeing how you're running your practice will help. Actually, there is, in West, there is the dental coaches who
hmm,
come into your practice to realize like what are you doing right, what you're doing wrong. And I think there should be, we also need something like that in our field, like business.
definitely.
Yeah.
Which is why, I feel that I told you, like, I have junior dentists who keep me on my toes because I like to give them freedom to do their own thing within certain parameters, of course, so
Mm.
that there is some fresh energy.
Yes. You learn
And we
from each
keep
other.
them, yes,
Yeah.
and we keep, see, everybody cannot have every kind of experience. Everybody studied from different colleges, have worked
Mm.
in different places. So you get to learn from everyone. And like you said, you're curious. I'm still very curious, even after so many years. I'm quite more than happy to learn new things. And everybody comes up with their techniques, their thoughts, and it's very interesting.
Yes, that is true. So, ma'am, like I have read on your website that only 4% of the Indian population is going to dentists. So, how do you change that mindset that is generations deep?
See, sadly, that 4% is mostly coming from tier 1 and tier 2 cities.
Yes.
And over in the tier 1 and tier 2 cities also, till now, I am seeing the change happening in the last few years, but even till now, people will only come when they have a problem,
Yes.
right? So, but what is changing the tide is educating people. So, I think all dentists need to constantly keep on educating their patients so that if one person does listen to something, they will go and spread the word to somebody else. Uh, in it is directly linked to education level, right?
Yes.
And it is also linked, the number of people who come for dental treatment are of a certain awareness.
Hmm.
Hmm? So education and awareness go hand in hand. So the
And
grassroots problem is education.
like not even just like it was a thing that people are fearful of dentists. They have dental anxiety. That's why they are not coming. But right now, like in your research, it has come up like because of attitude, cost, and access of the dental care also. Like, how did that
Yes.
surprise you when you realized that these are also the factors?
So one very important factor is expense. Most
Hmm.
people are scared of going to the dentist because they feel that the treatment is expensive. So we have had to, explain to people that it is not that dental treatment is expensive. It's just that neglect is very expensive. You come to us at a point where there is no alternative but to probably, do a root canal treatment and place a crown on the tooth, or to extract it and do an implant, which are all expensive treatments. Had you come to us earlier, we could have done restorations, done some conservative treatment, and you wouldn't have reached this point.
Hmm.
So, I think how we have been able to spread the message is by health camps, by participating in several health camps. So, with our van and without our van, also, we've been to several housing societies. We would personally go and request them to, so that they would allow us to conduct complimentary dental health care camps.
Hmm.
And in the last 5 years, I think in the last quarter only, in corporate organizations also, we've done camps, and in societies also, schools, all these places. So I think the last quarter only, we must have seen over 3,500 people.
True. That's a big number for the.
Exactly. Yes. So it took, see, I'm not saying that it's happened overnight. We
Hmm.
started with camps in societies where we would see, 12 people, 20 people at the most. So we
Hmm.
had to go personally approach society, sometimes pay money also to be able to conduct a camp over there.
Okay.
So, yeah, and then slowly, slowly, people started seeing the services that we were providing. And like I said, you have to act like a fortune teller. Your clinical skill should be such that you are able to predict. Sometimes I have given a proper written description to a patient of what all treatment is to be done, in which I divided into phases. Phase 1 is immediate requirement, phase 2 and phase 3, like that. And they have come to me after 6 months carrying that piece of paper that you had told me this. I didn't listen to you at that particular point in time.
Now it
And
happens.
now I am facing this issue.
Clinical skills and communication skills.
Exactly. So we take a intraoral camera, we take an intraoral scanner on these scams. You know what, we are when you and I are talking to a patient, if we are only talking, they are not able to visualize what we are saying.
Yeah.
So we try to show them what the problem is. And like I said, in the last quarter only, we must have seen more than 3,500 people. So my victory is, even if 25% of them have listened to what I've said and retained it, that is success.
It's like helping the community at large. Even if they don't come to you, at least they will have someone to go to and, get their health done. So it is a big win, even for, as a moral perspective, I may say, like, for us, that we are making some change in people's minds and health.
Exactly. So everybody can do this at their level, And now social media makes it very easy. You can reach out to people and give the right kind of messaging. So when I see, funny reels, it's nice, it's fun. But
Mm.
I think we also need to put in a little bit of something which is extra.
Yes. Ma'am, my biggest pet peeve is dentists making fun of their own profession. I see reels where they say like I'm going to buy Jordans after this patient, and
Anniversaries and a vacation, and I've seen that. Yeah.
it reinforces the fact that the patient already has this mindset that dentists take from us. Like they don't think about the materials. I think a dentist is charging more, and making these reels, and they become so famous. It it kind of reinforces the fact to the patient when it is not true. When we see our equipment, our consumables, our materials, everything like cost us so much money. But when you're saying like that, what will a layman think? Like a normal person, what will they think? So
I
frustrating, those kind
it
of
is,
reels.
and I have had a few people come and say this to me also. That,
Yes.
oh, now you're doing my work, now you'll go on a long vacation.
Yes.
I'm like, I wish that was true. You will be seeing me here tomorrow, day after, and next week also. I have not taken a vacation in the past 3 years. Okay. So it's nothing to be proud of. I wish I could take a vacation, but because it's a startup and there's so much of accountability, that
Yes.
I have just not had time for myself. So it actually undermines the hard work and tough circumstances that so many dentists face.
And many clinics are not running, ma'am. Like they are loss of patients and all. So, but when these things, I think it harms the profession a lot. And there are
I
many people like dentists are making those reels, like, and I saw that one reel also. Electricity bill came and they are showing that, come on, there's a space here, we'll keep an implant there. What will that affect the mindset of a normal person? Literally, they're saying
Wow.
there's a space here, he's checking up and he was going to say that there's nothing wrong with you. Then a message pops up on his like electricity bill is 20,000. Like, there's a space here, then we will keep an implant there. So I think it is hurting the profession a lot in long term also.
Definitely, we can't make. See, it is, if you want to be taken seriously, if you want the medical profession and the patients to take you seriously, you have to take yourself seriously first.
Yes.
We
I
have,
think
we have to respect ourselves and our profession. I have a major problem with dentists because many don't respect our own profession.
like it is reinforced in their mind. Maybe it is conditioned that we are not as good as our medical counterparts.
See, there are many things which I feel dentists are pulling themselves down also. For example, when we have doctors working with us,
Hmm.
they also don't understand the accountability that they should have. Right? See, everybody wants to be paid for good work, but you have to work first.
Yes.
If you have to have the clinical skills, you will grow, but there is some amount of patience required, and there is some amount of skill required for it.
Hmm.
So I think even dentists need to take their own personal skill development very, very seriously. It is easy to cry about dentistry not being a lucrative profession and not paying well, but you have to see the mirror and see where your skills are also.
Recently, I read a book called Management 500. In that, it
Hmm.
was written that for any person to become successful, truly successful, it takes 14 years.
I
So it's
agree.
many examples of how Tiger Woods started when he was 7 and he won his first championship at 21. So there was 14 years already he was in practice. People say that he won at 21, but he's not. They are not seeing how he has practiced for 14 years, improving every single day. And there was a case of Enzo Ferrari, the owner of Ferrari, how he struggled for so many years. Like 3, 4 examples were there. It kind of that patience is needed if you want to be truly remarkable in your field. And it
Yeah,
happens like all the dentists after 10 years of experience, everyone is fine. Everyone clinics are running. The clinics that are struggling are those who have started just recently. Like once they're established, they have good patients.
exactly. You have to be, like I said, you have to be at it.
Yes.
You can't give up. And if, as a woman, especially if you're married, you have children, if you give up your profession, then it's very difficult to take it up after that.
Because of the hand skills also. Like it's not your mind only.
Exactly. You lose confidence.
One of my colleagues was saying like even after 3 months of taking a break for my baby, like she worked till 8.5 months of a pregnancy. Just 3 months she took a break, and when she was giving INB, her hand was shaking. So
It
like
happens.
imagine leaving the profession for 2 years or 5 years and coming back to it. I think it is a bit difficult.
It can happen in corporate jobs, it can happen in other sectors, but sadly, in the medical and dental field, this is not possible.
Yes. At least other jobs they can start again with a lower ranking or something. They can do it, but this is like lives are in our hands. So
Yes,
it is.
but you know what happens is it's not like it's not possible. But what you said is you have to start at a lower level. You have to be willing to start at a lower level. You should be doing workshops. You should be, relearning certain skills, updating your skills, and then you come into the workforce. Don't expect that. Why will any clinic hire you if you've been out of touch for 2 years?
Yes. Take some courses. There are many clinical courses coming right now.
There are ways to get back into the profession also. So I would not discourage people who've been on a break. See, I know there are sometimes circumstances where you have to take a break. It's not in our hands also sometimes. So, but there are ways and means of getting back into it also. I don't think you should give up after a break. It might take a little more effort, but it's definitely possible.
Ma'am, I love your initiative of the dental van. It is essentially saying if patients won't come to us, we will come to them. Like, how did that idea came to you?
That was completely my husband's brainchild. Okay. Actually, what happened? During COVID now, we were getting a lot of calls from our old patients. We'd already been practicing for 15 years by then,
Mm-hmm.
and nobody was ready to see them. And they were in pain. Now, COVID does not mean that dental problems are not going to happen. So, we had to issue handwritten passes for them.
Mm-hmm.
It was scary for us to travel to the clinic, it was scary for the patient to come to the clinic. So it went on for a good, 6 months or so. And then my husband thought that what if, and there were some people who were like unable to climb down the stairs also. Older people, and somebody who's immobile because of some problem or fractured foot or God knows what not. So then he realized that what if we had a setup which could go to the patient, which we could sterilize and sanitize. And we would see one person at a time in a sterile environment where we are also at less risk. And the patient is also at less risk. Plus, you know what? You don't have to go through so much of red tape to come to the clinic at that time.
Yes. And like after every
So,
patient, we could do the fumigation also.
yes,
It
yes,
was.
yes. So that was the thought behind it. And after that, it just skyrocketed into other things. Then, when people saw this happening, once the van went to see one patient, then
Mm.
people said, do a camp here. We have so many people who have so many problems.
Okay.
Make the van stay in the society for one day every week.
So you started with the van first.
Yeah, we started with of course, we already had our clinics.
like this health chakra, like complete
It
entrepreneurship journey.
started with clinics and van, both
And
things.
okay.
But the van was is our USP. It
Hmm.
has now shifted into many other uh, platforms also. But we started with our clinics, existing clinics, which we converted into Health Chakra and the van. And we were actually sending the van with the proper, and I trained the team personally in the beginning. Hmm. So we have a proper set of SOPs which are still practiced to date. And the
Hmm.
van would go to certain societies, stay there every week for 1 day. And so that is how it started for us. That is how the concept started, because people were finding it tough to get there. We were finding it tough to get to them.
Hmm.
So we came with a solution which would solve all of our problems. And then so many people came to us. You would be surprised to know that there was a lady who had a bypass surgery, and during the surgery, her dentures got misplaced. So
Hmm.
just imagine you had a bypass surgery, now you can't eat.
Yes.
So within a week of her surgery, I made her denture in the van.
Yeah.
Yeah.
It was been. She must have been so grateful. Like
Oh,
you.
I can't tell you. But it was equally gratifying for me also.
Mhm. I was like
Then
helping
we
someone
had,
in dire
yes,
need.
absolutely. Absolutely. There was a lady who was highly diabetic, who had diabetic foot and who could not get down and travel.
Hmm.
So by some means in the lift, they got her down, and she had fractured her ankle also on one side. So she had not had dental treatment done for the past 8 years because of this. Can you imagine? For 8 years, she was surviving on semi solid liquid diet.
Oh my God.
There are many people like this, doctor. There are many, many people like this. I have treated so many of them. My team has treated so many of them. And we were able to do implants for her in the van.
In the van.
Okay.
Okay. Hmm.
Yes, we were able to give her fixed prosthesis. We were able to do extractions for her. So many things. I mean, there is not a single treatment which we have not done in the van.
Like, how does it differ from, like, ma'am, there are other startups coming up like Dent at Home, which
Hmm.
recently started on the Shark Tank India also. Like, they're also doing this, taking the dental setup to their homes. So how do you differentiate between that these both things? And it is
I
also based
think
in.
it's based in Mumbai and I think other cities also. I think it's a very good initiative. I think there are enough people that all of us have enough work and we can serve this community. I'm all for anything which is beneficial for the community. My only problem with doing treatment at home is the
Hmm.
safety issue for my team.
Yes. Like, I had this thought, actually, like, how do you ensure that you are safe first in, like, today's
Yes.
world
So
cannot say anything.
yeah. So in our van, in our setup, number one, we can manage. I'm sure they also manage the sterilization. They must be having their protocols and everything. But
Hmm.
besides this, it is still my environment.
Yes.
My team is there,
Hmm.
right? And
And
I personally, I'm not very comfortable with sending my doctors into somebody else's home. But having said this, I saw the particular company that you're talking about. I think it's an amazing initiative, and there are more than enough people in need that we can all work for them. I think it's great.
yeah, she is also a prosthodontist.
Yes, I think prosthodontists like to think outside the box.
Yes, I was also thinking the same. Like, with so many prosthodontists are branching out into many ventures, like even the health tech, like AI startups and all.
Yes,
Yeah.
yes. We face so many hardships during our post graduation now that we learn to think differently, because prosthodontics basically teaches you to manipulate and to solve problems.
Yes, we work according to the anatomy.
Yes. So
That's it.
there we can't go by the book. Every patient is different. For example, I treat so many geriatric people. I cannot go by the book where this they are concerned. You have to do patient specific, case specific work. Otherwise it will not work out.
This exposure was during COVID time. I was in PG, so mucormycosis cases, a
Hmm.
lot of mucormycosis cases, and I never thought I would see such kind of cases because it was not so common now. But during this time, mucormycosis, and one case came where the complete mandible was gone. So we had
Yeah.
to make a titanium mesh for the patient. Upon that, everything was in prosto work. So I think it gives us, like as you said, thinking out of the box thing. Yeah, like you combine three things: the van, teleconsultations, and e-Sarthi health bot.
Yes. Yes.
So
Yes.
how do those three work together as one system?
So, see, while we were establishing Health Chakra, we also, got calls and CVs from many doctors in different parts of the country.
Hmm.
So it was a question for us that how are we going to reach out to them?
Okay.
How can we, or we can use their experience and their work with us. So what we started doing was we started collaborating with these dentists, right?
Okay.
And we started developing Health Chakra partnerships.
Mm-hmm.
Okay. So, in which, if the doctor was unable to manage a case, or if they needed some advice or mentorship, as we were speaking about, right? So, we would do teleconsultations for their cases
Okay.
and help them to treat the patient.
Okay. So these consultations were not with the patients, but the doctors.
They were with the patients also, they were with the doctors also, we also have a medical team. So, they have been with the medical team also.
Okay.
So
And then
we
what?
collaborate with all kinds of specializations where teleconsultation is concerned. In fact, we also have a MD chest working with us in these teleconsultations. We have a pediatrician working with us in these consultations. We have pediatric dentists. We have orthodontists. We have all these people in teleconsultations. Yeah.
What is eSarthi health bot?
So eSarthi Health Bot is basically what we realized was, see, when a patient comes to you, especially somebody with comorbidities, they come with a huge file.
Yes.
Right? So
Hmm.
in eSarthi, in our app, we update all the patient's reports on one platform.
Okay.
Okay.
Hmm.
And with that, it is visible to any doctor who sees that patient anywhere. So suppose you get a dental pain in at say 1 o'clock in the night. Hmm?
Hmm.
We will have one, and we don't have a chatbot. We have a doctor
Okay.
on call, on duty, or a qualified professional who will
Hmm.
answer your questions. But they will also have access. That is your eSarthi. They will also have access to your medical records.
Okay. So,
Okay.
like, other dentists can also say, like, if they went to some other city, the other dentist can also access the records, or only the one working with health.
No, no, no. So the patient has to register themselves with us first.
Okay.
It's
No,
only
no,
for registered patients.
yeah,
No, no,
registered.
other dentists cannot. No, no. If they are a part of our, if they are partners of Health Chakra, then they can. But it will be, of course, we can't share data of every patient with every doctor. It has to be their data only in which they can share the records. Yeah. So it is specific to location, specific to clinic. Even in Pune, one clinic cannot see the records of another clinic. They have to request for access. They have to request for access. It has to be approved by a senior doctor and the IT head, and only then can they access the records of that patient.
That is wonderful, ma'am. Patient privacy is there, still there.
Data privacy, patient privacy is extremely important. We are very, very cautious about this. You will never hear any complaint of patients about their data getting leaked to anybody else. That will never happen with us.
And ma'am, like I thought this is like electronic health records, where in the West they have this
Yeah.
electronic records, like any doctor can ask for the access. So
No,
like
it's not like that.
yeah. So if the patient like changes the city or the country, if they are moving abroad, then do you provide an option where they can share the records with the other dentist?
Patient can always access their own records.
They can log in, see, and
Yes.
share it with
Yes.
some.
So suppose what you were saying, can a dentist access the records? If the patient shows them their records, we have no problem. It is their data.
Okay.
But
Yes.
on the system directly, they cannot.
Yeah. This is actually better. It protects your IP also and the patient's privacy also.
Exactly. Exactly. It is up to the patient. The app is on their phone or they can
Hmm.
log in online. And they can give the dentist, they can download their records at any point in time. No problem. Their invoices, their x-rays, everything.
Yeah. And ma'am, this is actually beneficial because many of the times I have seen as a cases for dental implants, the patient doesn't know which company of implant they have in their mouth. So this can help them. Like when we enter the data that we are giving this implant, and if they go to another city or even another country, they can access it and then they can show that
It's very
this.
strange because I've had screw loosening cases and I've had abutment disemplacement and everything. And it's so difficult because the patient is not aware only of what implant has been placed. And they
Yes.
don't, sometimes the doctors are very nice and forthcoming and they let you know also. Most people will let you know. But
Mhm.
if it was done 10, 12 years back, there is absolutely no idea of what was placed.
Yes. There is no data only actually. Like even doctors are done. And that time, 10 years back, the computers were common, but health records being on computer was not common. So
But
like
doctor, even after
manual
this,
histories.
even after this, we are very clear that we also have handwritten records.
Okay, you have both digital and handwritten.
You have to have handwritten records.
Okay.
It is a lot of data to save and to keep, but I think every center should also have handwritten records because it is also important. Digital records are important. Handwritten records take up a lot of time and effort, and you should keep them for at least 5 years.
Yes.
Your digital will, of course, be there forever.
Mhm.
You never know when rules change with governments and organizations where they want to see handwritten records.
But digital actually helps though, ma'am, in
Digital,
this.
you have to.
For and all.
I'll see, doctor. What happens is that we have the facility, we are in structures in which digital records are possible.
Hmm.
There are companies charging a premium account amount for digital storage where people have to keep on renewing it.
Hmm.
Okay. And one fine day, if you forgot to, or if you couldn't do the payment of that particular service, you have lost all your records.
Yes, that is correct, ma'am.
And there are some prime services which are not very responsible with your data,
Yes.
which is
Yes.
also a concern.
Yeah, and we hear so many like things about patient data leak, or even credit cards. There's a leak. We hear so many things like that.
So pick and choose your service provider very carefully. That is why we developed our own system because we didn't want to develop on a third party for this.
Okay,
But
that
I
is
know it is not feasible for everyone.
yeah. Yeah. So you have your own patient management system, I guess.
Yes, yes.
Ma'am, yeah, like you are focusing more on the rural side of the country. So it was a conscious business decision or a values decision?
No, no, we are not focusing on the rural side of the country at all.
Okay.
We
Like you,
focus on, no, no, we focus on urban areas and we help in companies who are doing CSR activities in rural areas.
okay. I thought like
So,
these vans are going to the rural communities for the checkups and all.
no, 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 no. The van goes to rural communities when there are people like the Rotrack Club, the Lions Club, so many organizations, private organizations, and other NGOs who we collaborate with, like blood donation camps and all. We collaborate with them and we go into rural areas, but that is not our core of what we are doing.
Okay. And I think rural dentistry is also lacking, no, ma'am. Like with dental vans in villages where there is no dentist for like 1,000 kilometers,
So
dental vans can help there.
I definitely agree, but this is something that the government initiative has to be, and there has to
Yes.
be a government initiative for this because it has to be on a very large scale.
Yeah. You're providing an idea, no, ma'am. For when I think
I
government
mean,
should take that.
definitely, definitely. In fact, I would be more than happy to collaborate with the government and to, because we have faced the challenges on how to design a van and
Yes.
what is required in the running of it, what are the shortcomings, everything we know. I would be very happy to collaborate with the government to come up with more of this and establish a system for it also. In
I
fact, we
think
have made several proposals for this.
uh, like it will be really beneficial for the poor of the country who cannot, who haven't seen a dentist in their life. So I think it
I
is
have had such experiences. So
yeah.
we were working with an organization who had adopted a school, a girls' school in a very small village.
Hmm.
And we were doing a dental cleaning for the children. They had never seen a dental chair in their lives. They were so thrilled. They did not know that the color of the teeth is white and not yellow, how it was.
That's like India needs a lot of, even I think change in the from the top for this to become
That's what
aware.
I'm saying. So the more people who jump into the bandwagon, the better it is in whatever way it is possible.
So how
But
many
I
vans
think
are you operating now, ma'am?
currently we are only operating one van.
Okay, okay. I think building a van is also financially also it is a bit
It is quite a task. There
heavy
are very
investment.
few people. There are very few people who can design it for you the way you want it. It's not like a basic college van. There is a lot more to it. Like I told you, we've done implant procedures and everything. So it is more equipped than a clinic.
It's like a dental ambulance.
It's a complete dental ambulance. It's got two chairs in it.
Acha.
Hmm.
Ma'am, you don't share these photos on the website, like van photos.
I have shared some pictures, but like I said, since the past 1.5, 2 years or so now, it's been very, very difficult for us to focus on anything. If you see my LinkedIn account only, you'll get to see a lot of pictures on that.
Okay, I'll check it. Ma'am, so how do you measure success? Like, is the number of patients seen, conditions caught early, or communities reached?
So it's a very difficult question because I think I'm not successful yet. So
What's the
what
diverse
makes
parameters?
yeah? So till date, my main parameter for success is if my patient is happy. That is the first parameter for me personally.
Hmm.
Also, more than that, now my success is related to my team.
Hmm.
So if my team is performing well, if the patients that we are seeing as an organization are happy, that according to me is a very big success. And how many people have we been reaching out to? I feel that number should keep on increasing. That is direct success because the more you educate, the more people will come to you, and the more dental treatments, correct amount of dental treatments, you will be able to deliver after that.
And how do you plan to scale this model?
So, we are already scaling up. We are already based in Delhi, also, we are based in Goa. We have several other cities coming up working on a similar model. And my main aim is not to compete with dentists, but to collaborate with them.
It
So,
takes
that is what we are doing.
it takes our community to educate the other other communities
Exactly.
as well.
Exactly. So, we are collaborating with doctors and with dentists, and we are
Hmm.
working with them rather than competing, setting up our centers and competing with them. That's not how we are going about it.
That's a beautiful thought. Ma'am, like if any policy maker or a hospital group was listening right now, what would you want them to take away from this?
I would want them to understand that the dental department in your particular hospital is extremely important. It is not just one chamber which needs to be there because as a requirement.
Hmm.
Rather, they should invest a lot of time, energy, and have the right kind of doctors over there to deliver a well rounded quality healthcare to their patients.
I think dental departments are often, neglected. We see just in a corner office or like that, not given much importance to the dental departments.
Also, dentists need to, like I said, upgrade their skills, be on their toes, and not take their profession for granted. See, doctor, there are multiple MBAs and engineers also who pass out every year. Not everybody reaches the same level of success. So,
Yes.
not every dentist is going to reach the same level of success. It's not about only getting a degree, it is after the degree when the real work starts.
No, I heard a dean said that, treat it as your base and then think about how to build the building. Like, don't think yourself like, as soon as you pass out, don't think that I'm a doctor now and I don't need any more
Yes,
learnings, and be a learner for your life.
exactly. So I'm still learning. I like to say that I am still learning. And I think the day you stop learning is the day you stop working. You can't succeed in life like that. It's not possible. So you have to constantly keep on learning, constantly keep on upgrading. Knowledge is not stagnant, it has to grow.
Once you become complacent, then you lose your competence in the market.
Everybody tends to get complacent after a certain time, but those who do not become complacent and who keep on going on are the ones who actually achieve something.
Ma'am, complete the sentence. Like healthy smile means
Healthy smiles means healthy life.
one health habit you personally swear by.
One health habit I personally swear by. Actually, there are so many health habits, but hydration. Okay. So I make sure that I'm having 2.5 to 3 liters of water every day. That is one health habit I definitely swear by. Not only for the oral cavity, but for the general health. Yeah.
General health. Ma'am, a book, podcast, or a person that changed how you think about health.
So I read this book. Very surprisingly, it's not about health, but it's written by a clinical clinician, by an MD medicine. It's called Many Lives, Many Masters by Brian Weiss. So it touches upon the topic of rebirth actually. But what got me into it was what I understood from that was this doctor who was a trained scientist who
Hmm.
never thought of anything besides clinical medicine. He turned into psychiatry and he was hypnotizing a patient of his. And he
Hmm.
had to change his concepts completely. So, besides the topic, which is interesting to me, might not be, many people might not believe in it, but what it got me thinking was at no point in time should science become a limitation.
Yes.
So,
That is
even now, before I start a treatment, I will always take the name of the higher power to guide me through it. Yeah, I really believe that the healthcare sector is it's a calling. So you should keep your mind open to many things.
you need to align with the higher power, like to.
Yes. So maybe some people are atheists and they don't believe in this, but I really feel that we should not let science become a limitation for us. That's what I feel.
Even like doctors see more miracles than any other person. Like same medication can work for one person, and same medication cannot does not work for the other. So I think doctors believe more about spiritual forces.
As you keep on practicing, as you grow in your profession, you tend to really start believing more and more in this. When you come out of college, you are very idealistic and black is black and white is white. But real life is not like that. It's got a lot of shades of gray in it.
Like, what's one thing about dentistry you wish people were not afraid to ask?
I wish people were not afraid to ask about the pain, actually. Right? I wish they were not afraid to ask about the pain because what happens is the fear is bigger than the pain itself. So, if they have had that discussion before we start a treatment, they also know what to expect and they're not so scared. Some people have told me after the treatment, oh my God, I thought it was going to be so painful, but it was nothing like that.
Yes. Like they have this preconceived notion that the dentistry is painful.
Also, I think I want the stigma to be going to a dentist be removed completely. If somebody is suffering from halitosis, please talk about it with us.
Yes.
We could help you find the deeper cause for it also. It could be gastric for all you know.
Like how can a dentist change the mindset of people apart from patient education?
By being very open and communicative. See, build your communication skills. I really believe half the treatment is in the conversation. If you are not confident about how you're communicating with your patient, if you're not confident about your knowledge, if you're not confident about what you're saying, the other person will absorb that energy from you and they will not understand what you're saying and they will not give it importance. And somewhere it plays on the end result also then. You may be perfect clinically, okay?
Hmm.
But if the patient has not got that confidence from you or has not got the right communication, then it also affects the treatment result, according to me.
That's true. Like We have to explain in their terms rather than speaking clinically, or what
It's
we
not
can.
only that, you have to establish a rapport. So, see, a patient doctor relationship has to be built.
Yes.
So, I
Mm,
think, what we are lacking is in the dental profession, we are lacking this training.
yes. Like patient communication, I think, and patient education, patient communication, practice management. I think these two things are need to be incorporated in our core
There
syllabus.
should be something about patient psychology also, I feel. Understanding psychology, I think it's extremely important.
Mm.
It comes with practice when you see many patients, but if it was taught as a proper subject, I think it would be really helpful.
We have psychology of only a part in the pedo, but nothing for the
Yeah.
adults. I think adults are more complicated than kids. One last question. I'm like, how do you see AI in all things here? Like, how do you think AI will have an impact on the industry?
I am already using AI, okay, because now the current breed of scanners which are coming are giving AI reports to patients.
Okay.
So I think AI has a major role to play as far as dentistry is concerned. It has already been used in your CAD CAM and your intraoral scanners and planning your aligners and so many things. And I think it's a very, very good tool. You have to learn how to use AI in the dental field. Otherwise, you will become obsolete. And AI will be very useful in studying trends. So, like for example, if I use AI on my data right now, I can get so many insights
Hmm. Yes.
that suppose I put in diabetes and root canal treatment in my particular data, I come to know how many diabetic patients required root canal treatments compared to the people who did not require it. So it helps me analyze and treat my patients in a better manner.
I mean, and all. What all things are you using AI, ma'am, apart from scanners?
So currently we are using it for data analysis.
Okay. How about patient communication? Like,
Not as a chatbot we tried it, but what happens is patients want a one-on-one discussion. They are not satisfied with the chatbot as far as the dental field is concerned, medical fields also. So how we are using AI is also in training doctors.
hmm, like for
So
the and all.
exactly. So you know what? We are developing a system in which when a doctor asks a particular dental trained chatbot for a question, they will get the answers for that based on our current data, based on the treatments that we have delivered.
So you have kind of created your own AI for
Yes.
doctors working with
Yes,
you.
we are using AI for our purposes and we are not using any data from outside. This is our database, our treatments, our treatment planning. See, as a young dentist, you're very confused about what treatment to give. When the patient has 10 things going on, you don't know how to put it all together
Hmm.
because you have been taught pain ho raha hai, root canal karo ya extraction karo, and that's it. You
Yes.
don't, as a prosthodontist, you learn FMR and so many other things. But as a general dentist, it takes a lot of time to learn these things. Even as fresh MDS, it's very difficult.
Yes. You need to have some training.
Yeah. So that is how we are using AI to train people.
Thank you, ma'am. Thank you for your time. It was such an insightful conversation, and I'm so amazed by all the things that you have built for yourself. I think everyone should have that mindset. Like, if it is not there, build it for you.
Yeah, it's difficult, doctor, and thank you so much to I'm having this conversation with you. It was literally therapeutic for me also. I'm so happy that as a young prosthodontist, you're taking this initiative to reach out to more people. Even
Thank
your
you.
story is going to be inspirational to a lot of them.
I hope so, ma'am. I'm still in the training.
No, I'm sure it will. Small steps.
Yeah.
All
Thank you.
right. Have a good day. Thank you. Thank you so much. Bye bye. Bye.
Bye.